Hi, good evening. So tonight's talk is about psoriasis. So psoriasis is a fairly common skin disorder that is basically a disorder of the immune system and the skin both. What happens is normally the skin takes about 27 days to kind of turn over and shed, but in psoriasis, in certain areas of the body, that turnover happens in only about 4 days because the immune system cells kind of creep up through the layer of skin and kind of start attacking it and making all sorts of changes happen. Typically, psoriasis features are thickened areas of skin called plaques, and those plaques can vary quite a bit in size. And depending on the type of psoriasis, more details later, it can make very, very big plaques, very small plaques, sometimes little scattered plaques. Oftentimes the nails are affected. Sometimes you can tell someone has psoriasis by looking at the fingernails, and it looks like a little pin has been pricked into the nails, and it causes like a little pitting phenomenon. Occasionally, someone will actually present with arthritis and not so much skin manifestations. I've seen that a few times in clinic before, where someone comes in with joint pains, and then only later, eventually, we figure out, oh yeah, they had psoriasis that was causing the joint pain. So I highly encourage anybody that is interested in using some of my tips to improve the immune system overall to check out also the video presentation on basically how to control the immune system through a particular elimination diet that I found to be extremely helpful along the way. So there's some interesting things with psoriasis. So just kind of going over the overview, I've got a couple of references pulled up here. In particular, the Up to Date has some very nice patient education things. I'll put the link in there a little bit later. But also the brand new PCRM Nutrition Guide for Clinicians. Good morning, Farhan. Thanks for joining us. And it's kind of really fun. Whenever I do these Doc Talk presentations, I always end up learning something new. For example, there's not very much on Gregor's resource, nutritionfacts.com, but he does have a very nice presentation about the link between salt and autoimmune diseases. So I guess by way of introduction, I'll go over that briefly. The thing that's exciting about that is because salt is one of those things that it's easy to control in the diet if you know that you really, really need to control it. And I think most of us really need to control it, we just don't realize it. But they've actually done some research and found that there's a link between the amount of salt that people are eating and their risk for not just psoriasis, but all sorts of autoimmune diseases. I've noticed myself that if I have something very salty, I tend to get a little bit more flare of the immune system afterwards as well, so I can kind of vouch for that personally too. But we know that the Western wonderful. I hope you enjoy this talk tonight. Nika, she says she's also suffering from both psoriasis and psoriatic arthritis. So good. Hope this talk is helpful. So anyway, getting back to the salt. So what they found is that when they've done some studies where they actually were able to completely control what the people were eating, most of the time when you're doing a study on anybody out here, there's a huge amount of variation in what people are actually eating. Sometimes they're eating things that they don't think have a lot of salt, and sometimes, just a huge amount of variability. So you lock them in a lab, you feed them a prescribed diet for a certain amount of time, and then you can do all sorts of checks on them for like how their blood vessels are doing and how their inflammation markers are doing. And they found that a particular type of autoimmune marker called the Th17 cell is something that actually has a salt receptor, like an enzyme that gets turned on by the salt. And this immune cell basically seems to turn on and causes a whole pile of inflammation in the body. So anyway, it's just very interesting. If you want to check it out, I'll have it on the link. They also said followed the multiple sclerosis patients and found that the ones that had more salt tended to have 3 to 4 times as many exacerbations and 3 times more likely to get lesions in their brains and stuff. And similarly, with asthma, the folks that were on a much lower salt diet ended up having much fewer flares and much less severe flares too. So there's something to do with salt in the immune system. The body is very, very, very able to absorb even a tiny amount of salt from basically plants in the soil that gets on things. Like, imagine you're like prehistoric humans running around in the world somewhere. This was long before the invention of salt shakers, right? So our bodies are really, really able to grab every little bit of salt possible. Unfortunately, in our world of incredibly easy to get salt added to pretty much everything in our foods these days, where many of us are kind of salt overloaded, and that contributes to state of chronic inflammation across the way. All right, so back from that quick segue. So psoriasis. So if you got psoriasis, you are not alone. In America alone, there's 7.5 million that have some form of psoriasis. And the plaque version is the most common, 80% of cases, and you can read up on more details about that later. The nail changes that I mentioned, that pitting nails, about 50 to 80% of people with the psoriasis who get that pitting nails, thickening and other discolorations. And then most of the time it is something that kind of comes and goes, like any autoimmune disease. So the same sort of triggers that I talk about in the other autoimmune disease presentation go along with psoriasis. Now, some forms of arthritis and immune system is more or less invisible. And in psoriasis, however, very often when there's a flare, it's extremely visible, and this causes people a lot of grief overall, just broadly speaking. Occasionally, 10% or more of the body can be covered with thick, scaly things, plaques, these lesions that are on the skin that are not contagious, that's not going to spread to anybody else. But a lot of people just are not very familiar with psoriasis, and or the people that are suffering from it oftentimes feel very self-conscious, embarrassed, anxiety, and all that kind of stuff. And unfortunately, those emotions also trigger the immune system to be more stimulated, which then triggers the autoimmune manifestations of it. So that's one of the reasons why getting it under control, one way or the other, is of vital importance to allow people to maintain their happiness and their joy and their connection with others, and to not be afraid to go out in this wide world and to be seen and loved and all that. But if you have somebody or know somebody that is suffering from the psoriasis, please have that extra compassion and reach out and just sometimes make sure they're doing okay, because there's a significant amount of depression and sometimes, not everybody, but sometimes a little bit of suicidal thoughts. And so in that sense, this can be a deadly disease in that way. And occasionally with the arthritis, which occurs in about 15 to 25% of patients, kind of like the rheumatoid arthritis, if the arthritis is left untreated for a long time, the swelling and the changes to the joints sometimes can be permanent as well. So if somebody is one of that 10 to 20% of patients that's also having the psoriasis, it's important to keep an eye on it and, of course, work with all the specialists that you're working with to keep it under control, to keep the joints, healthy and not distorted. So most of the time, psoriasis occurs before age 45, although anybody at any time can catch this. And pretty much any of the varieties of humans or races are affected, but there seems to be a link between certain, maybe something to do with the genetics. It seems to be relatively rare in the indigenous populations or Native Americans of North and South America. So about half of people with psoriasis do have a particular first-degree relative that might be affected as well. And there's a particular gene that increases the risk about tenfold. If you're curious, it's called HLA-CW6, if you feel like going and hunting around for it. And certain medications can make it worse as well. The ones in particular that worsen it are lithium, beta blockers, which is a kind of a heart and blood pressure medication, a type of blood pressure medication called an ACE inhibitor, certain antibiotics, certain psychiatric style of medications, and, believe it or not, NSAIDs, in other words, Motrin, naproxen, and ibuprofen. That category of medications sometimes can make it worse as well. Let me just pop over to my other reference over here, because I think there was a couple of other ones there. Treatments, yeah. I'll just stick with the one spot. Sorry for the distraction there. All right, so getting back to it, certain patients with certain immune system disorders are also particularly at increased risk. So, for example, HIV, or children that keep getting recurrent infections, such as recurrent strep throat. There's a type of psoriasis that is linked with something to do with the strep throat infections, the guttate psoriasis in particular. More on that in this article. And then stress. Yeah, so basically, as mentioned before, the stress of life, of anything, and even of having an immune system disease in the first place, triggers the immune system and makes the disease flare up even more. So stress reduction techniques can be very, very helpful. If you go and look around my new website that I made to help organize all these videos and try to make it a little bit easier to find things, docroho, docroho.com, you'll find that I've recorded a few things I found to be helpful. For example, a brief guided meditation and some joints and glands exercises and some other kind of philosophy things that may be helpful for taking the edge off of some of the anxiety and stress and stuff like that. So those are very helpful for just helping to mitigate the symptoms over time. And besides that, it kind of feels good to kind of get the joints in the body just kind of moving and paying a little tender loving care to the body as well. Yeah, so thanks, Ryan. Hope you enjoy. Obesity. So there's a lot of studies that show that increasing weight also causes increased amount of autoimmune diseases in general, and this is no different than that. So there's something to do with the extra weight puts out more inflammatory cells. Climate. So we talk about with psoriasis, sunshine, good old sunshine, can be very helpful for it. So there is, of course, a degree of moderation. So if you go out there in the summertime and expose the body to the UV light of the sun, then it has a calming effect on the skin. However, if you go out there and fry yourself to a crisp or get too much sunshine, well, too much of a good thing will trigger that inflammation again. So again, just be a little bit mindful of that. And I would recommend go with the recommendations of your local dermatologist as well. Vitamin D, many autoimmune diseases, there seems to be a link between low vitamin D and the regulation of the immune system. So for a lot of my patients in general, I've been recommending a little whiff of vitamin D, just held up as an example. This one's happens to be 10,000, but most people benefit from 2,000 units of vitamin D a day. And you can also reference my recent review of Gregor's presentations on vitamin D as well, in my most recent presentation from last St. Paddy's Day, actually. And then there's another thing with alcohol and tobacco. So, of course, tobacco is one of the most inflammatory things that's out there, so I encourage everybody in general, but especially those who are suffering from autoimmune diseases, if you got anything to do with tobacco or vapes or chew or any of those things, to get away from that stuff as soon as possible, because that is extremely like pouring oil on your raging fire, and it will tend to make things much worse in the long haul as well as in the short haul. And alcohol. There was some interesting stuff about alcohol. Skip to that at the bottom of the article real quick. There is, for women, having more than 2 or 3 alcohol beverages per day, much higher risk of developing psoriasis, mostly seem to be associated to the beer. And in men, heavy alcohol of 100 grams or more a day. Not quite sure how many drinks 100 grams is, but I'm sure they can look it up later and figure it out. So both a risk factor for developing psoriasis as well as worsening it as well. And so if a person is using alcohol and attempting to treat or cure their psoriasis, it tends to kind of be one of those things that you're trying to move the disease this way and the alcohol is moving it back the other way. So even if you get a little benefit, you would get a heck of a lot more benefit if you just let go of the alcohol too. So just something to consider. So even in light to moderate alcohol users, there wasn't a correlation between the alcohol and how severe or how troublesome the disease was as well. So addressing a healthy weight, so reducing the weight in general, one way or the other, lifestyle and other therapies to reduce it does tend to improve the condition. And it also helps to improve the cholesterol profile. So it's very common that when someone has the autoimmune disease, that in addition to it manifesting in the skin and the joints, oftentimes the blood vessels and other things carry the weight of that inflammation, and inflamed blood vessels tend to clog up more and tend to get more heart disease and such. So reducing the risk factors for things that tend to clog up the arteries, such as weight loss, such as particular foods that are really good. Check out my cholesterol video if you want. See, I've been working all year to make you guys videos on this stuff. So lots of things to enjoy. But basically, anything you can do that will reduce the risk of heart disease in general should improve the psoriasis as well. So there is some interesting things talking about how a plant-based pattern in general is a very anti-inflammatory pattern, and basically we don't have any large controlled trials on this yet, which is probably why my favorite doctor doesn't have many presentations on this topic quite yet. I'll be looking forward to nutritionfacts.org and seeing how it comes out over the years. But I have also found that in my patients that have adopted mostly plants as part of their diet, that their autoimmune diseases tend to improve greatly. In fact, one of my patients a little while ago, a couple weeks ago, found me outside the clinic and said pretty much, thank you, and basically said that some of the tips that I'd given them many years ago had very much improved their psoriasis, and so they just came out of the blue to let me know. So I'll give you a couple of those tips now, just by way of sharing. If you want to see more on my new Doc Rojo website, I do have some of the handouts on there that I give out in clinic if you want to see some of the other things that can be helpful for the immune system. Flaxseed, I don't have any studies on flax seeds in psoriasis per se, but there's a lot of research that shows that flax seeds in general are very good for skin conditions. So usually I recommend a few tablespoons of these ground up and added to the diet. It's extremely healthy for you anyway, and if it happens to improve the psoriasis, even better. But it's also like anti-cancer and all sorts of other good awesomeness. Turmeric is another one that I tend to recommend. Keeping the lid tightly on because this stuff stains like crazy, so don't spill it on anything. But at least a quarter teaspoon of this turmeric, grocery store turmeric, doesn't have to be a capsule. Added to the diet at least once a day if you're trying to control arthritis or something, 2 to 3 times a day, in addition to the other healthy lifestyle measures we talk about. And then there's something that was, Farhan is asking, how do you eat flax seeds? Well, I take a little coffee grinder and basically put it in there because the goodness of the flax seed is locked in those little tiny shells and the husks of the seed. And so in order to really fully get the lignans and the other good stuff out of it, if you use a mechanical grinder, it's actually way better and more effective at getting the stuff out than just using your teeth. I do not recommend just eating it directly because it's kind of dry and it's kind of gnarly in the mouth. But it goes very nicely in smoothies. It goes very nicely on things like cereal, for example, like oatmeal, having a whole grain oatmeal in the morning. That sort of thing. So that's just one little suggestion on the flax seeds. I got a whole video on flax seeds too. That's one of the first videos that I ever made on this format, so if you want to check out the old work. And then there was some interesting stuff about essential fatty acids and olive oil. So recently in the St. Patrick's Day talk, basically I was talking about the very, very few dietary supplements that I recommend for people who are following whole food, plant-based, or just kind of looking to improve what's going on with their life. And one of the things that came up was the enlarged omega-3 fatty acids. So flax seeds, by the way, are a wonderful source of a type of fatty acid called ALA. And our body converts a little of that into the long chain. And for optimum brain health, you need a little extra of that. And so there are varieties of things, just holding up as an example, nothing too special about this one. There are different varieties of omega-3s. This one is 80% DHA, EPA kind of stuff. And this one in particular is made from algae oil because some of the downside of the fish oils is, unfortunately, when you're mining the fish of this world, which is crazy polluted, you also end up with a bunch of things like mercury and stuff that you really don't want to have go along with it. Unfortunately, we don't have a lot of studies that show something like the alga oil having improvement yet, just because we haven't done the studies yet. And so shout out, call to action. If anybody is a researcher and wants to go looking at that, I'm sure you'll find something useful in that direction. But what they have done studies with, they did do some studies with fish oil and extra virgin olive oil. And there's a little bit of disease protection with the folks that were using that. In general, as mentioned before, I would favor having olives more than the olive oil, but in fairness to the research that's actually been done, they use the actual oil. So there's a big difference between extra virgin olive oil and regular olive oil, and you got to be really careful for the brands because the extra virgin is so much more expensive than the regular olive oil that many times it's been adulterated because many times we can't tell the difference in taste between the original and that. So if you actually eat a real olive, you know exactly what you're getting, and any olive oil that is naturally present in that olive will, of course, be extra virgin because it's not been processed. So, as mentioned, take it with a grain of salt, so to say, or don't take it with a grain of salt because salt is bad for the arthritis too on that. So, again, I mentioned these in passing. Partly because these are some of the things we actually have some trials on, some evidence on, but knowing the theory of the plant-based diet and a lot of the other things that go along with it, do highly recommend the actual food is way, way more superior than the olive oil. In general, I recommend staying away from oils as a kind of a rule of thumb. So. And then there's another thing. If you look at the video that I put on how to control the immune system, there are about something like 10 foods that are most common triggers for the immune system, and to kind of go through in detail on all of those in that presentation. And there is a significant link for many people with gluten and the inflammation of the psoriasis. So and that's not too surprising because it just is one of those things that has a tendency to cause inflammation in many people, not everybody, but in many people as well. So the psoriasis patients have about 2.2-fold higher risk of having celiac disease than other folks as well. Green or black olives, any one that you like. Just try to look for the ones that are not soaked in oil and that are not salted, because unfortunately a lot of the olives out there, as much as I love the olives, I look at the can and I realize that these things are packed with a ton of salt. Maybe as a preservative, maybe because people are so used to having a prepared thing with it. But yeah, I think that there's probably not too much difference. I'd have to go digging back into my favorite nutritionfacts.org to see what are the studies on the olives as to particulars of which ones are the best. So maybe another video one of these days, so check it out. All right, so what else can we talk about tonight? So yeah, I haven't really gotten into much of the treatments quite yet. Treatments, obviously, there's a huge range of things that people can do to treat psoriasis. Diet is one of my favorite topics just because it's so easy to play around with and add things and subtract things, and you get an effect fairly quickly on the body. The autoimmune elimination diet that I recommend, that's described in that other video, basically only takes about a month to go through the whole elimination diet, and then you add things back one at a time and you just see, okay, what is causing the flare. And the folks that have the arthritis version, you should be able to tell if it's trouble quickly. Usually people can tell sometimes as fast as 5 minutes after it's eaten, and sometimes maybe after an hour or two, but usually it's if you've got an autoimmune disease that's affecting the joints light up like a Christmas tree, essentially, when you eat the wrong thing after it's been cured, essentially. Well, maybe not cured, but really well managed as well. So anyway, more on that in the other video. So other things, easy stuff, topical moisturizing creams and ointments are a very first-line types of therapy, and they reduce the itching, the scaling, and just a thick moisturizing lotion. Dr. Greger on Nutrition Facts does have some nice video about comparing like olive oil topically versus coconut oil versus petroleum jelly. And believe it or not, in terms of softening things like lesions, the petroleum oil like Vaseline like things actually were better than even the coconut oil, which a lot of people like to use topical coconut oil on things. So anyway, something else to check out if you want to look at things later. And of course, there's tons of different kinds of shampoos that have steroids in them. As you might know, the psoriasis plaques tend to go along the hairline of the scalp very often. And so being able to put the steroids all over the place is very helpful. Vitamin D analogs, sorry, I can't pronounce this, calcipotriene, maybe because people with psoriasis are low in vitamin D, or maybe something else, another unknown enzyme or something. But there seems to be a relationship between being able to put a type of vitamin D on the lesions that tends to slow the growth of and the turnover of those cells, and helps to make them flatter and get the scales off. And that can be used just by themselves. They can be used in combination with the steroid creams and stuff. There's another one called anthralin, which again you can talk about with your doctors. That's been around for about a century or so, so a long time. And that basically inhibits the DNA from being made, because again, the skin just naturally turns over very quickly, but in psoriasis it turns over extremely quickly. It's like these things are on fire there. And then there's retinoids, and so sometimes they can be helpful. Sometimes, so this is called tazarotene, and so one of the things you got to be careful in that is sometimes making sure that if you happen to be a woman, that you don't try and get pregnant while you're on this stuff, because some of those vitamin A based treatments can trigger birth defects and stuff. So again, another reason to obviously have this conversation with your own primary care doctor and dermatologist and maybe rheumatologist. Coal tar. Now this was one that always seemed a little bit odd to me when I was growing up in medical school. Like, seriously, the people with psoriasis put tar on their skin? And actually, it's true, yes. It is a very old therapy as well, and it's one of the oldest known treatments for it, and so it especially reduces the inflammation, the scaling, and just troublesome parts of it. So again, and it seems to be about as effective as the vitamin D analogs. And then there's a couple of other things that are sometimes used off-label, and they're referencing the topical calcineurin inhibitors called tacrolimus and hymacrolimus. Guess I should have practiced saying these before the video, but basically these there's a whole bunch of these kinds of things. So we are again, things that might be helpful, but on the other hand, there seems to be a alert that the Federal Drug Administration issued with the link between those two medications and maybe lymphoma or skin cancer, but that's something else to be mindful of. So again, looking at all the different options. So again, it's always a risk-benefit ratio. We talked about phototherapy in the form of actual sunlight. And sometimes people go to the dermatologist's office to get light therapy. Sometimes people will buy these UV light boxes that they sit in front of. I was familiar with those growing up because up in Massachusetts there's not that much sunlight in the wintertime, so a lot of people were having these light boxes to just kind of boost the exposure to bright light. But anyway, so there's something about the interaction of the skin and the UV rays that tends to be helpful. So there are some laser treatments that can be done in certain dermatologist's office that can be helpful and very safe for targeting like specific plaques and making it so that you don't have to come as often to their office. But again, weighing those risks with the benefits, having excessive sun time can also be associated with increased risk of skin cancer. So another reason to discuss all this directly with your providers, whoever's taking care of you. And then just a few other things. There's a whole bunch of different kinds of autoimmune drugs that can be used. So there's a lot of different kind of varieties of those. Now, when you get to those things, it seems to be a lot more serious, like oral vitamin A versions and methotrexate and folic acid, and basically with that, instead of listing out all these things, I'll just say there's a lot of these things out there. The side effects of these medications tend to be pretty significant. You can think of it as like a slow chemotherapy, trying to use a hammer to squish the entire immune system, and sometimes you need that. And believe me, there's more than one way to modulate your immune system. And if you need to use it, so be it. You know, better than suffering. But if you're able to do some other way to's, I think it may be useful to incorporate some of these other ideas as well. And then last but not least, as mentioned in the beginning, some of the psychological approaches can be very helpful. I found that deep relaxation in general can help to improve the immune system. I used to find that going and sitting for meditation, I would go in there with joint pains and flaring, and by the time I finished a nice relaxation and focused meditation session, that the joint swelling actually would decrease within half an hour of doing it. So that's another thing that I can definitely vouch for directly. But there's all sorts of different ways in which people manage their stress, for lack of a better word. Practicing lifestyle management, in other words, creating your world around you as best as possible to minimize life stressors can be very helpful. Sometimes having a therapist or a counselor, cognitive behavioral therapy, a mouthful for like guided stress management or guided life management sessions with a psychologist or psychiatrist, someone who specializes in doing it, and it's like their bread and butter. They know it very well and can do it. And then also some of the virtual societies and such can be very helpful, because sometimes when someone has one of these diseases, they can feel very isolated, very alone. Sometimes, like I mentioned in the beginning, people are kind of afraid to reach out and see other people because, you know, they're afraid that other people will like judge them, and sometimes they do, you know, because people don't understand other people often in this world, so to say, to put it lightly. For example, I remember a long time ago, I was selling, I don't know, some sort of candy bar for some school fundraiser, and I remember we visited the place where the candy was being made, and the person who was creating this was a beautiful, beautiful person, but the reason they were in the back making the candies was because they had the psoriasis, and they had this fear of going out in public with it. So you can imagine that that basically something that is so visible often, just because of the very nature of society and social interactions, can become a barrier. And being able to work around this and be able to connect and have that, and have basically freedom in life to be able to do whatever you want to do without fear of what are other people going to think if I happen to have a spot, or if I happen to limp or walk funny or something. It can be very liberating for folks, and can help find that joy as well. So anyway, hope that this talk has been helpful. I mostly went through the brand new nutrition guide on the PCRM website, and I'll put that link on there a little bit later. And Sharon, I'll go ahead and link the latest from Dr. Greger on olives. Maybe there's some good tips. Maybe some olive is better than the other as far as other health benefits or something. But I guess that's about it for tonight's talk on psoriasis. Next week, I'm not quite sure what next week's topic will be, but I'm sure it'll be something good. Thank you for watching. Enjoy, and have a happy life. Take care. Bye-bye.